Hey, we have Monica from Barton Health. You're not riding today?
I wish I was.
Doesn't
Maybe
Barton
I'll get
give
out
you
there
snow
later.
days or anything like that?
Well, you know, the snow days sometimes are busier for us.
Well, you can do work on the mountain.
That's right.
No? So we're going to be talking about the Barton Community Health Assessments. That's going to be the main emphasis of our conversation today. But first of all, give us a little overview about Barton. You guys got a lot of new things coming out and a lot of new, you guys are giving lectures now. So it's a lot about education, which this ties into a little bit.
Yes. We are actually doing a lot of wellness programs now. One of the things that we added last year, which has been really successful, is the Wellness Lecture Series.
Fantastic.
And we have anything from heart health to diabetes to a lot of orthopedic preventing injuries in our wellness lectures, and they're all free and they're online and you can see what they are. But last one we had was with Dr. Young, our new cardiologist, and we had over 100 people attend. We were very excited.
And everyone, I've been to a couple of them, and they've been I'm overwhelmed by the amount of people showing up. So it's a great thing because I'm an educator. Might not come across as that, but I am, and I really believe in this. And that ties into your community health assessment thing. Now tell us a little bit about that.
Yes, healthcare reform. Some of you may have heard of that.
That thing.
Yes. Healthcare reform has required that all hospitals that are nonprofit, which we are, conduct a health needs assessment of our community every 3 years. And we're very excited about this because a lot of community hospitals, such as Barton, are really the safety net providers for all healthcare. With government programs cutting back, there's less and less of the government programs, and the hospitals are picking up all of the slack. So we really want to know from our community what are the gaps in healthcare that we're not providing, or where are the barriers to access? Like, are we not providing what we need to be providing? And we're partnering with a lot of other entities to make this happen.
So tell us how it's going to work.
Well, what's going to happen, it's a 3-part process. The first is a phone interview. And we're trying to get at least 400 residents of the South Lake Tahoe area to answer a bunch of questions. It takes about 20 minutes. And we just want to find out about chronic health conditions, safety issues in the home, other issues that you may have with your health in this community, and try to identify from the residents' perspective what their issues are. And then we also have a focus group session where we invite community leaders and other health partners such as El Dorado County Public Health, school district, people from the college, to also help us in assessing what those issues are. And then the third part is is collecting information from El Dorado County Public Health, the Nevada Public Health Facility, and then also gathering stuff from our own physicians.
And this brings up a good point because people are always complaining. Oh, they don't ask me what I want, and they don't. No one ever. Well, this is their opportunity to express that, right?
Exactly. We want to hear from our community and find out from them, the individuals, what they need from us, what we can provide for wellness programs, so we can keep them out of the hospital.
And then the next question everybody's going to want to know is, how long are you going to keep me on the phone, Monica?
It's on average 20 minutes.
20 minutes.
And that's a long time for some, but this is really important. We really want people to tell us what they need, and then we can create programs around that. And one of the requirements for this Healthcare Reform Act is that once we gather this information, we need to do something with it. And so we will be putting together some action plans and sharing that with the community through town hall meetings. Maybe we'll come back here and talk about what the results are and be able to share what our action plans are for the coming year.
Well, I'm excited. I think it's such a great service that you're letting the community, you're kind of asking us what we really want. So now you have no excuse, folks.
This is
your
time.
opportunity.
That's right.
For 20 minutes, you can just rant and rave about everything.
That's right. That's right. We want to know.
Is it going to be in Spanish for
it will
us
be.
ESL people?
Very good question. It will be conducted in English and in Spanish. And the length of the questionnaire will actually change depending on whether you have kids, whether you have chronic health conditions, because we do get into a lot of detail. So there's a lot of follow-up questions that go into that.
And is it going to remain private? I'm sure a lot of people are wondering that, because they don't, I don't want my stuff out there, because it could.
Right, completely anonymous. And the other thing that happens is that we don't even hear. We don't even hear who the names are or exactly what people were called. All we know is the results from the survey.
And what are you going to do with all these results? You're going to compile them and do what again?
We are going to bring them out to the community. We'll have a couple town hall meetings where we will share the results.
And those where everybody can attend, right?
Exactly. Anyone within our community can hear those. We will also have a special website where we will have all the data, and people can even go into the in-depth in the data and be able to see by zip code or by chronic condition, what we have in our community. So it's going to be very open. We will be publicizing everything that we find out and share that. It also gives us an opportunity to allow our other community partners, such as Live Violence Free, Tahoe Youth and Family Services, other groups, to be able to use that data and get grants for further programs to help our community.
And that's very, very valuable. Grants are huge, and it's kind of cool to see everybody working together, because that's kind of what we need to do now, is pull different resources together to do great things.
Exactly. Yeah.
Monica, you're so fabulous.
Oh,
thanks
well,
for all you do at Barton.
Thank you.
Barton does great things. We got to actually sit in with Dr. Welker the other day on surgery.
Yes, he is wonderful.
You guys have some great surgeons.
Very lucky. We're very lucky.
And building by the day, with Dr. Young coming in now.
Yes.
And all kinds of new stuff coming out. So thanks again, Monica, for coming in. Thanks. People need more information. Barton, you know where it's at, right?
Yep.
You'll take care of you. Monica from Barton Health. Now we're going to check in with your South Shore Entertainment Update with Ashley Lanier, the birthday girl.